Hey everyone. Welcome back to this episode of the Reinhartz Rundown. If you're looking for a COPD review, great news, we've got an entire series here for you. Today we're going to chat about blood work. In particular, we're going to talk about biomarkers and their usefulness in the clinical management of COPD. We can do a lot of testing in COPD, spirometry testing to evaluate forced expiratory volume or FEV1, alpha-1 antitrypsin deficiency testing, sputum cultures, pulse ox and oxygen saturation, chest x-rays, exercise testing, and more. But if your patient has COPD, you might be asking, should I be ordering blood work? As of February 2022, there are really three main biomarkers emerging in COPD clinical decision-making. We'll discuss at least the first two here. Procalcitonin is number one. Now, this is interesting. We know in the hospital setting, we widely see procalcitonin levels monitored in lower respiratory infections like pneumonia to help with guiding decisions on antibiotic discontinuation. However, so far, procalcitonin does not appear to be as useful in COPD exacerbations. Some of the early data is conflicting, a little concerning, and really at this time, experts are not recommending procalcitonin-based decision-making in COPD exacerbations. Number two is C-Reactive Protein, or CRP. There are a couple European studies where they tested CRP in patients having a COPD exacerbation. They would then hold off on antibiotics unless the CRP was high. They found that they could reduce unnecessary antibiotic use and that there really was no impairment in treatment outcomes. For now, of course, keep in mind that the data on these labs is generally weak, that interpretation of a CRP level should be done cautiously to help guide therapeutic decisions. And of course, the primary justification for antibiotics in COPD exacerbations continues to be symptomatic presentation and functional status of that patient. Lab 3 is our blood eosinophil level. Now, there is definitely some usefulness here for checking an eosinophil level. It makes a big difference in how effective your decisions of therapy are likely to be. We'll be covering that in our next video. That's the Reinhartz Rundown. Go ahead and subscribe below if you're interested in learning more, and we'll see you for the next one.